because SAA, I always have to have my donuts. I did stop this morning, so I've been having my donut holes during breaks, so I have not missed that. So, but the reality is I'm going to start off talking a bit about collection development on something with reopening and during COVID, and then Beth is going to present a case study that's been happening on reopening because she's had a lot of different things that have happened at their institution that will be very beneficial and can help all of us there. So the reality is, during the work from home phase and the reopening, I think the majority of our time, it was really spent and focused on the health and safety of our employees and our researchers. And one of the things is collection development might went a little bit by the wayside, but not the donor relations. And that's one of the things that I discovered, that when we went to that work from home, my phone started ringing off the hook. And mind you, I had to transfer my work phone to my cell phone, so I did not miss any of those calls. But some of it was surprised me. It was from donors that had already gave the collections. They wanted to know, oh my God, you're closed. Nobody can have access to the collections. What's going to happen? And that type of thing. And so we had to make sure about our messaging also to reassure them that, number one, yes, we are closed to the public, but we are going in on a limited basis to answer reference questions and do some research. But if it was an intense research project, no, they weren't going to be able to come and use the collections that at that time, but we would try to work out different arrangements. The other thing is they were just concerned that it was going to be in an empty building. I don't know how many times that I really had to talk to the donors and saying, no, we've got security in place. We have water monitors in place. We have fire detection systems in place that are protecting the records, but also that we are going in on a regular basis to make sure that the archives is safe. And I said also the police, they really know the value of the collection. And so they were keeping an eye on things for us also. But it was very interesting, the concern. I think some people, they just had more time to sit and think about things, and they got worried about those types of things. But the other thing that was happening during this time was that people were cleaning out their attics and their closets. So again, getting a lot of phone calls, getting a lot of emails, but some of it also was, I would say probably 60% of the calls that I got about giving us certain items and artifacts, they wanted to sell them to us. They did not want to donate them. They wanted to make money. They needed money off of those items. And, we really do not purchase items. So I basically had to say, if you're willing to donate, then we can discuss. But again, because we were closed, that also meant the mail service to our building was closed. So it was then, could you hold on to it until we reopen? And then can you send it to us? Most, if they were willing to donate, were willing to hold on to it, but they're like, well, my wife really made me clean out that closet. I need to get rid of it, And it's just like, well, can you stick it in your, can you just put it back in the small corner of your closet or whatever? But then again, it was, it was really, really something we needed. We could probably make arrangements, but most of the time, a lot of things is that it was, especially with artifacts, with items, we probably already had something in our collection, so that it was like, if you want to put it up on eBay, go for it, and that type of thing. But it was very interesting because people were really asking about the collections, wanting to know what happened to them. And then, just really, some of them, it was because they were near campus and they saw just how deserted campus was. So that, again, it was all about that safety and inquiring then, how could this research happen? Because that's one of the things that we sell our donors on, is that we want their stuff because we want people to research with them. And now all of a sudden they're totally locked off. So some of the things that also happened is that there was a few instances when due to, an estate closing, the house is being sold, and we needed to go in and get the materials quickly. It wasn't just the normal, again, thinking, hey, I'll make an appointment. I will go in and pick up those records and bring them back to the archives. It actually became quite the production when you start thinking about it, because number one is they're probably, especially in a lot of the instances, I was meeting an elderly person. So I needed to think about their safety. So if it was that if I seriously was going to go in, I quarantined myself ahead of time just to make sure that I was not going to infect that individual. But also it came down to my safety too, because there were some individuals when I was talking to them, I was like, okay, if I come, masks have to be worn, gloves have to be worn. We're going to have certain safety measures in place, and I had one that was just like, nope, you're not going to make me wear a mask. I'm not wearing a mask. And I was just like, well, then I can't come. And I also had to clear with my administration if I could do those trips. And that all had to be cleared up at a higher level of administration to say, yes, I could go and do that trip. So again, but I said I would only go when I had those certain factors in play. So, and it was when I explained, for both of our safety, we need to do that. But in, one of the instances, it was no. And then I said, well, you're going to leave, you're not going to be in the house for a few days. And at this point, you still had the different realm reports coming out about how long does the virus last on certain things and all of that. And so it was like, well, if you came in on the weekend, you're not going to be here till the next weekend. Can I come in that Friday then? And that would give 5 days of the house being empty. Could somebody let me in, and could I box up the stuff and bring it back to the archives on that Friday? You would be back there on Saturday to see what was left and that type of thing. They agreed to that. But again, it was like, they still could not believe that I was being so hard-headed about not wanting to come in and those circumstances. But again, it was down to the reality is the collection versus my health, what's worth it, what's not. You weigh those balances out. And the reality is, we still got the collection in. He would have waited a little bit. The other option I was giving is I'll just have movers come in and takes, certain things, but I knew it was kind of a messy collection. So I probably wanted to go in there and just pack up what I wanted for the archives. But it was those types of considerations, thinking about the safety of the donor, thinking about your own safety, because I'm sorry, my job's not worth going and maybe catching COVID when I don't need to. And my employer, they supported that also. It was like, if the circumstances, if these conditions aren't met, we understand why this is happening. And sometimes that was a little bit difficult to explain to certain individuals who just believe, nope, we need that, you need to go get that, and that type of thing. But to explain the circumstances, explain the factors, and saying, here's the criteria that needs to be met for us to go in, and to actually have the environmental group, the environmental emergency group, actually support that is the criteria needed, because we are not putting any of our employees in harm's way. And so it was those types of things that I wouldn't have thought about this pre-COVID. I mean, sometimes, you've gone into really dirty places when you've done collection development and had to go pick up some stuff, but never in this type of circumstances. So it was all of those types of things that really started to play into where could we go? How could we still do collection development during this time? And there were certain things that just kind of had to sit and wait until we could become more fully functioning again. But also, that was also a silver lining, because during this work from home time, it gave me a time to really sit back and actually take a breather, because we were always just constant boom, boom, boom. And so it was during this time, since we couldn't bring, everything was kind of at a slow, we were closed, we couldn't do certain activities and that. So we could, what activities could we concentrate on? One was looking at what should our collection development be. And at the institution here, we've been through numerous administrative changes. So we've been in kind of a chaotic state, and we've got some stability. We have stability, not some, we have stability in our leadership now. And, we've got a clear focus on what direction, what areas do we want to collect in. So it really gave time for me to sit and really look at and concentrate on those areas. So one example I'm going to use is architecture. Architecture, we have the only school of architecture in the state is located at Clemson University. We should collect architecture. Well, when you say that we should collect architecture, what does that mean? And there's a lot of people that collect architecture. So, what type of design archive should we be? So some of it is it really gave me time to sit back, look, what's all happening. But what is also very valuable is it gave me time to talk more with our School of Architecture, to talk with the faculty members saying, everybody keeps saying this, what do you need? how should we look? How should we be, how should this develop? What type of directions are you guys going? What type of research is happening? And when you start looking around, there's a lot of design archives out there. So where's our niche? What could we do? Where can we fill a void that is maybe happening there? And everything else, well, talk about timing. Gotta love it sometimes. Our void is healthcare facilities. That is one thing that our School of Architecture is really taking the lead in, is healthcare facilities. What timing? So the reality is that that's where we're going to find our niche. We're going to concentrate because, we can't collect everything and everything. You know how large architectural collections can be, the preservation concerns and everything else that happens with it. So we're going to concentrate on healthcare because number one, we've got in our faculty here, they are leading the way in healthcare facility design and looking at things. Now talk about timing. We're going to be starting collecting now. What's going to happen to healthcare design in the next couple of years and beyond because of the pandemic? It's changing. It is really making them rethink the design of places, how the building should be, what type of rooms, everything else that's going to be happening there. So we're hoping that, we'll got this right. We had a great time to really start documenting it, collecting it, and we're going to be able to really take it in different directions at a time when there's a lot of changes happening in that field. Now, would I have had time to do this if there wasn't COVID? Oh, no. I wouldn't have even so the professors even had more time to talk, which usually never happens. So, part of this is in the collection development during COVID, it's really, you got to take the opportunities. I could have sat there going, oh, I get all these phone calls and then people that want to donate another little pin that I've got 20 of them already in the collection, or, they really think they have a John C. Calhoun wooden cross, but where's the, can you prove it? No. I just think it's wood that you need, a piece of wood that you need, So it's like, sorry, I know it's got a JC engraved on it, but unless you can prove it. So, that was one of the nice things is that, it gave you, and it was like, I think we were going for a while there so much on, oh, how are we going to make sure everything is working from home? And then once working from home dragged out a little bit, it was like, okay, what else can I concentrate on? And so that's when really it came into play to look at collection development and that type of thing beyond answering those questions and answering the concerns of the donors and that type of thing. But it led to different opportunities. And hopefully we're going to really be moving stronger forward in doing what we're doing here with healthcare architecture. I think what's really interesting is it gave us time to develop the collaborations and the support that is needed for this. And, we'll see how it goes forward from there. I hope in a couple of years from now, I'm going to be telling you we have a whiz-bang healthcare architecture, design archives. I love it. People don't say architecture anymore. They say design. I'm getting into the lingo for everybody here. I'm getting into their lingo and they're understanding my lingo. So that's good. But, it's during these times that, it can have time for reflection. And so that was what was nice is it gave us time to really look at this area of emphasis that we needed to develop, but how could we go about developing it in the correct way, a sustainable way, and that type of thing. So we're really building in the partnerships, the collaborations that we need with the school, with the development office, which is going to be very important because funding is going to be key for us to move forward also. And so it's so why everybody's had to kind of rethink their jobs and rethink how they do their work, we were able to move in and develop this type of collaboration. So I think, we'll see how things go as we're all getting more active and back at work on a limited basis and all of that. But, I think it's, we got to take these opportunities and that's what we did. And so we'll see how our collections grow. There's a lot of different things, but I'm going to turn it over to Beth now to talk about her case study. And we can talk then too about, different things we've discovered once we reopen, because, you think you have the best laid plans and then you get reality. So take it away, Beth.
Great. Thank you, Brenda. Yeah, a lot of really good things to think about at this time. But I want to talk about South Caroliniana Library as well as Thomas Cooper Library a little bit, because for right now the two are interconnected. And both libraries actually fall under the university library's umbrella as well. So the university actually had positioned our libraries pretty well for a shift in operations when we had to make that. First, they had moved us to Office 365 back in 2017. So that meant that, you know, our working files were in the cloud, and we had built-in access to apps such as the Microsoft Teams for virtual meetings and chats and file sharing and whatever you needed. And both university libraries and Caroliniana had in Microsoft Teams, we used those a good deal to set up what they call channels, where we could share information about professional development, projects, what each department was doing. And we also set up things that, channels that, you know, like Caroliniana called coffee break, and university libraries called water cooler, where we could try to connect sort of that socially, like we did when we were all working on site, you know, catching up with the personal news and sports and whatnot. And then second, the libraries had to complete what was called a continuity of operations plan, or a COOP, for the university, specific to COVID-19. And we actually did this back in 2009 when N1H1 came on the scene. But the difference this time for us was that the Dean of Libraries had the university library's emergency preparedness and response team work on this or complete the COOP. And that team has representation from all areas of the libraries, as well as those university programs that are housed in Cooper Library. So there were a lot of people working on that. The team members then worked within their own departments to have a plan specific for their areas, using that general COOP as a framework. So fortunately, when the governor shut down universities and colleges with very little notice in mid-March on a Sunday, we were able to shift to a virtual environment. I'll say easily, but there were some issues as well. But and so unfortunately, I guess you could say, all of the planning, the COOP and departmental planning, really was happening all at the same time. And right before the closure, so that many areas in Cooper and even Caroliniana, we were still working on our plans for what it would look like if we did end up having to work from home. The libraries actually have a great IT department, and so anyone who needed it was given a work laptop or allowed to take their desktop computer home so they could work from home. The laptops were actually part of a cache of laptops that students could check out from Cooper. So we were very fortunate in having those available. They also loaned out hotspots for staff who did not have internet access. You know, we heard that not our staff member, but a Cooper staff member would actually drive to McDonald's to log in to be able to do some work. So fortunately, we were able to, you know, they were able to get their hands on some hotspots and loan those out. So, you know, as we all know, being away from the collections was hard, but the Caroliniana staff found out that we really could respond to many of our reference requests using our online resources as well as institutional knowledge. And then our personal libraries helped as well, sort of interestingly. And we created a spreadsheet of South Carolina books and other books that we have at home in case we needed to scan something or check a reference for a patron. And we also had a spreadsheet going that we could track our reference request, and especially noting those requests that needed follow-up once we were allowed back in the building. So our student workers and staff helped with archive space data input, and we helped checking metadata for the digital collections folks. and really any other online project we could think to do. We really wanted to try to keep our students employed for as long as possible, not knowing how long this would all last. We shared, as I said earlier, we shared links to webinars, online readings, other professional development through the Teams app. And of course, we all learned how to chat and video conference in Teams and Zoom and Blackboard. Previously we had used Teams, but really only minimally. And so I know at least for me, there was a learning curve involved in all of this. And I think we've all become a little more forgiving about technical difficulties these days, as we all experience them much more than we ever did before. So as the university was rolling out their COVID safety guidelines and developing reopening plans, the dean again had the emergency team work on the reopening plan for university libraries. And so with that plan again as a framework, each department then worked on their reopening procedures. What sort of special considerations may need to happen to keep staff safe in sort of the work areas and things like that. And we were very fortunate to have access to epidemiologists and healthcare providers who could answer questions and help us when we were making our plans. And we also have very good access to PPEs, plexiglass, and other supplies that we can use to create a safe environment for the staff as well as for patrons. And the dean has really been very supportive in all of the efforts to make the staff feel comfortable about coming back to work or finding ways to continue to work from home, if there's need for that. As some of you know, the Caroliniana Library building itself is being renovated. So our search room, some of our collections, and some of our staff are actually housed in the Cooper Library. And in the early days of the pandemic, after the university shut down, staff could go in long enough to pick up files and other things that were needed to be able to work at home. Of course, we couldn't take any of Caroliniana collections home, which meant very little processing on actual hands-on processing. But then the custodial sanitized the building, and so access really was restricted, and we really couldn't go in for a while. Once that was loosened, though, we could go in long enough to, again, pick up things. And we had to tell them where we went in the building so custodial could go behind us to, clean. But we really couldn't work in the building. So, again, we were continuing through most of the summer, trying to do as much as we could virtually. And as the Cooper Library reopened the first week in August, Caroliniana staff used that week to make certain that our reading room and quarantined area were in order and to begin setting up research appointments. We have collections stored in 2 offsite locations as well. So that means that we have to build in time for retrieval and quarantine of those materials before a researcher arrives. The size and the layout of our reading room, as well as availability of staff, dictated that only 1 researcher at a time could be in the room. So an early concern was being able to judge how long a researcher would be with us based on the amount and type of materials requested. While our user services staff are becoming more adept at this, I don't think that they've quite developed a foolproof formula. But I'm sure that if they do, we will all be hearing about it, and it will be wonderful to have that. So we're operating on an appointment-only basis and on a shortened schedule of Monday through Friday from 10 to 2. And this is really mainly due to staff availability. We really were not able to rehire any students that used to work on the desk due to university budget cuts. So we're really relying on full-time staff to be able to go in and do that. So appointments are really quite a change for us because we've never required patrons to schedule an appointment before. At this time, Cooper Library is open only to members of the university community, but exceptions are being made for non-university researchers needing access to special collections. However, what this means is that staff member has to go meet the researcher at the front door of Cooper and escort them to and from the reading room. The researcher cannot remain in Cooper beyond their appointment, and this really is due to, again, who has access to the building, but also the building capacity for Cooper, because that is now limited due to COVID. So we set up our quarantine area with protocols based largely on CDC and DHEC guidelines and the realm testing results. We're actually using an old walk-in vault, which we were just using for storage. So we're not having to take up any of our very precious workspace for quarantining materials. Researchers are required to wear a mask at all times, and we ask them to use an alcohol-based hand sanitizer during their visit. So unfortunately, the restrooms are not conveniently located to ask them to wash their hands right before they start their research. We're keeping our door to the hall closed so that we don't have students wandering into our area looking for study space. But all of that just adds sort of the high touch areas between our reading room and where the restrooms are located. We're also not requiring researchers to wear gloves except for the normal use with photographic materials. I know that some places are requiring users to wear gloves, but we have not gone that route. We do ask non-university patrons to indicate if they have any COVID symptoms. For university employees and students, that is a requirement already. But although I think we might ask anyway. Our procedures are communicated to the patrons when they set up an appointment, so they know all of that ahead of time. And we do build in time into the schedule to be able to sanitize between researcher visits, which is really important. So normally we would have 2 staff members working the reading room, but we reduced that to 1 because we could not safely accommodate 2 people at the reference desk. Staff are required to sanitize the keyboard, mouse, and phone before and after use. And really this is true for any shared equipment, such as scanners or copiers as well. And we remove pencils and paper from the desk. I believe we still supply, though, pencils if needed. Right before we shut down, we had bought a box of those golf pencils, the little golf pencils. And so we were giving those to patrons and they would just keep those. And so we probably are doing the same thing again, if needed. We also took out our 3 public terminals, which were mainly used to access the catalog, the online catalog. Again, that was just to, keep from having to sanitize so much. And what we found really is that most patrons come in with their laptop anyway, and they can access the catalog and other online resources from their own laptop. So staff do wear face coverings, actually everywhere in the building except in their own office. This is now a requirement for all university buildings, but it was actually something we were exploring for patrons fairly early on in our planning discussions. So we continue to do actually a lot of virtual reference and have expanded our scan and deliver services for those researchers who cannot travel, but also as a way to reduce the number of on-site visits. If we can do scan and email something, that really will help us as well to maintain a safe environment. So we're reviewing our policies, including what we charge for copies and services, and actually how patrons register with us. The special collections libraries at USC have been trying to get a shared online registration system for many years now. And this pandemic has really highlighted the need for one. Reducing points of shared contact, such as paper registration forms and call slips, is important in this environment. We had Ask a Librarian chat service before the pandemic, but we now also have Book a Librarian, which allows for more in-depth conversations about research and resources with the head of our user services. This also allows our staff to determine if a visit is necessary or again, if materials can be delivered electronically. And eventually we will, more of our staff will be available for that book librarian service as well. So our collection development is very similar to what Brenda described. Permission has to come from higher up than our dean. So with the travel restricted, we're really limiting those requests, although we have done a couple of sort of high profile collection pickups. One of the benefits actually of having an off-site storage facility is that we can actually have donors drop off material there, providing, everybody's doing the mask and distancing as much as possible. So, we have been able to continue bringing in some collections. On the staff side of things, we looked at our workspace, and fortunately, most of our staff have their own office area. One person did share a space with the refrigerator. So we looked at moving the refrigerator because it's much easier to find space for that than it is to find workspace. One person had their graduate student working in their office, and so they planned their week so that they do not overlap and both understand the cleaning procedures that are necessary. And we use a pre-COVID shared calendar to note who will be working on site so that those who wish to minimize sort of unnecessary contact or interactions can find quiet times to come in. We plan for traffic areas in our stacks, but the number of staff really has remained low on site. And so I'm not really sure we're using those. I know, I'll admit, I have not used those when I've been in, just mentioning stacks, if anyone's interested, Cooper Libraries actually closed their stacks. So, that's a big difference for Cooper. Staff have their own assigned book carts, and the coffee pot has been unplugged. So big change. And that was actually a recommendation that came down from university level on shared things like coffee pots. So we have a very different working environment these days. Most of us work a hybrid model, while some continue primarily working from home, which you can see dining room here. Gone are the days, though, of the casual exchange of ideas and news about collections and possible donations and other things that we would share, as we saw each other in the library. We quickly discovered also that virtual meetings are really not very conducive to batting around project ideas or good discussions or quick brainstorming sessions. But we're persevering with those because this is really the only way we can meet in groups. So we're trying to make it work. I think one of the unanticipated benefits has been that our user services, gosh, that's tough, staff have more time to engage with researchers on their topics and to see what materials beyond those requested might be helpful for them, as well as providing the rest of the staff with a deeper understanding of how our collections are being used. Also, we're looking at how we operate with a slightly different perspective these days, which hopefully will lead to improved services for our patrons who live all over the world. The questions of why are we doing it this way and how might this work in this environment, are not just for the public part of what we do, but they also bleed over into the back of the house operations, which could lead to more efficient processing, how we store materials and other matters on that. So on a personal note, I'll just say that my collection development really has increased. I've been able to attend webinars that I probably would have felt I just didn't have time for before COVID. And I've been able to catch up on my reading. So there have been some benefits. So while this time is, this is really a very trying time, both mentally and physically for all of us, there is the possibility of some good coming out of it as we all look at how we operate. And as Brenda said, maybe looking at what we're collecting and how we're collecting it. So with that, I will open it up. We do want to invite people to share, what's going on in your shop. And we'll be certainly glad to take questions, whatever questions you have. Again, via the chat or just chiming in.
Yep.
I've got something in the chat from Tracy. Being able to engage with researchers in more depth about their research sounds like a major benefit for both Caroliniana and researchers. A question unrelated to Caroliniana, though. Has Thomas Cooper Library closed the stacks only for the pandemic, or will that be a permanent change going forward?
No, it is just for the pandemic. And there are a couple of reasons for it. For those people who have not been in Thomas Cooper Library, and for those people who don't realize that Clemson has a Cooper Library too. So Thomas Cooper Library at USC, there are 7 levels in the building. And knowing sort of how the building worked beforehand, we knew that, there was always a long line waiting to get down, waiting for the elevators to go down to the lower floors. The lower floors were sort of cramped in terms of study desk being placed within the stack areas and things like that. So we decided fairly early on that we would actually close the lower three floors of the library. And that was where most of the stacks were. And in doing that, we realized that we would have to find a way to provide books as much as possible. And so, and also the other aspect was that with the virus, the quarantining of books was also an issue. Having space to provide enough quarantine area for the number of books that circulate. So, so Cooper moved to a request service. We were actually mailing out books to faculty and staff and students during the summer. They request them through the catalog. Now we continue that somewhat, but we also have an area at the very front of Cooper where people can come in and pick up materials that they've requested. And we're also working with Potty Trust as well, so that people can access books online. And we're working with, and I never can remember the sort of acronym, but providing textbooks to some extent as well, virtually.
Okay, from Anne Merriman. Do either of you have suggestions about best practices for initiating outreach to the community in order to collect specific materials? For example, what sort of verbiage do you think would be effective? Or is this something that shouldn't be considered at this time because of COVID-19?
Brenda, I'll let you.
Yeah, I was just, I think that, there hasn't been too much change in my verbiage out to them. I think some of it is it's going to be the process has changed. If I don't know, but some of it is that we still are doing collecting, but in different ways, or trying to, target certain ones still and maybe make sure that they hold on to the material until we can properly receive it in that type of thing. Or are you talking more about just COVID, trying to collect for the COVID-19 and what was happening there?
I turned on my microphone so I could.
Go for it.
I think it was, what's prompting my question is with the NEH grant that we were awarded back in August, one of the priorities for me early on, before any of the pandemic hit, was to continue outreach into that specific community, because the very first time we ever met with them and introduced that we were going to try to get this grant, people had showed up with so much material. And so now I'm faced with, how do I reconnect into that community to say I'm ready to take on more of this, but now I'm sitting here in this pandemic, and that's really kind of where I'm looking for suggestions or guidance. And it might require more of a one-on-one conversation, but I thought that might be helpful for the group to kind of hear an overview.
So some of it is it like, you know, you can't do the outreach, you can't do the events where you can publicize what you're having that kind of builds that community also. So some of, is that part of it is how do you build that community in a time of pandemic?
Yes.
Yeah. Zoom, unfortunately, is what we've been using.
Yeah, and that will be an issue because there's a fair number of this group that are, you know, elderly or really not technologically savvy. So it's such a horrible situation.
This is, I was going to say, Anna, I'm afraid I'm sort of blanking on your project, but I'm assuming it's university related. So could you sort of call on university communications or alumni services to help with that? You know, getting the word out. And I mean, I guess part of it also is, you know, are you ready to have materials coming in? Is your library ready to have materials coming in as well? So, you know, I understand, you know, wanting to be able to have that continue, but even if you're not at the point where you can actually have materials coming in, maybe just using those avenues as a way to sort of keep that project in front of people, maybe. I don't know. Sort of.
That's actually not a bad idea. I might be able to work through that somehow. It's actually the NEH grant is the Landmarks of American History and Culture. It's a workshop grant for K-12 teachers. And we're using the Beaumont Mill and Village as our landmark. So it's connecting with that community, which is outside the university. But that, you've given me maybe some ideas there. So I appreciate that.
Actually, I think outreach has been really interesting in this time because I've actually done so much more of it, and it's through Zoom, but it's been I can easily get to the meetings where before it might be very difficult to get to their meetings. There's an Ali group, and it's the Furman colleges started this, and I'm gonna steal their idea somehow, but I'm presenting at their group actually, and it's called Cocktails with a Curator. And you're supposed to have a piece, you know, favorite piece from your collection, and you have to have a matching cocktail with it. And so it's a Friday night from 5 until 6, but it's got over 60, 70 people coming in to each of those cocktail nights. So that's how they start their Friday evenings off right now. So there's different ways you can highlight your collections. But it has been amazing how much, you know, different groups, because they're meeting on Zoom too, or that they're meeting virtually, so whatever. So we're going into their virtual meetings, just like, you know, we've had more time to do professional development. These groups are doing things that we can connect into. So it's been quite surprising how much outreach has happened during this time.
From Tabitha, Beth, for virtual reference visits, are you using Teams also or another system? You mentioned that your scanning fee schedule has been adjusted. Have you increased or decreased fees? And how have users responded to this change?
So I'll admit, I'm not real sure. I think the virtual chats are run through SpringShare, maybe. I'm not sure about that. It's something that the university libraries is using, and that's really not something I've actually taken much time to learn about. I just know that it's available to us to use. It is not Teams. However, when you book an appointment, you can then set up whatever platform you want to use to be able to you know, have a video meeting if you want to with a researcher. So the fee schedule, we decided that once we were able to begin filling some of those requests that came in since March, that we really would not charge for the scanning unless it was a very significant order. A lot of scanning was involved. We have not made this a formal policy yet. We are still looking at our fees and how we want to move forward with those. So it's probably going to be an adjustment down instead of up. But again, we have instituted a fee that if someone needs scanning of a lot of material, they will pay for that, sort of an hourly rate. And people seem to be okay with that so far. So yeah, I mean, you know, we're still reviewing a lot of things with that.
From a list.
I want to add something on to that quick, because it's been very interesting with virtual reference. And one of the things that we're getting here is a document camera. And it's interesting because you're really learning much more about their research process because you're having to have that more in-depth reference interview. And so some of it with the document cameras, you're kind of going through the folder with the researcher at the time to help them get an understanding. And that's been really enlightening to understand that process. And so I think it's going to really benefit how we think about how we provide reference services in the future.
Yeah, that's interesting.
Okay, from Alyssa, what are some ways that everyone is trying to keep morale up in their library communities, despite how quickly and extremely everything has changed?
Yeah, it's been difficult. You know, I mean, you know, librarians are supposed to be introverts, and I'll admit that I am. So I've sort of enjoyed, you know, but I really do miss the interactions with my colleagues and you know, having that sort of one-on-one, face-to-face chat. And you know, we did, you know, sort of set up that. Coffee thing in Teams or the water cooler. You know, it works somewhat, maybe a little bit. It does allow people to feel like they're somewhat connected. But yeah, I've not really seen or heard some good ways. I mean, you know, except for maybe some virtual happy hours or something, you know, where everybody sits in their own home with a beer or drink of some sort. So I don't know.
Yep, we've done those. We also do lunch socials, like a Friday lunch where everybody can come in, coffee, like the coffee. We do virtual coffee, but also you have different social channels on Teams. But yeah, and it's interesting. I'm gonna pick on Clayton because I see he's on here. We actually have somebody that started in the special collections and archives, and he actually is still not on site. So, you know, it's been interesting too, is that how do you connect to your new coworkers when you're in this virtual environment? So trying to figure out different methods for people to connect up and just to have opportunities just to talk, some of it not work related to where can you have more casual, let's get to know everybody type of events and that type of thing.
Poor Clayton isn't just not on site, he's not even in the state.
Oh yeah, that's hard.
But he's part of he's part of SCAA.
Tracy has something in the chat that Newberry celebrated homecoming at home this week, and a centerpiece was Wednesday's virtual trivia night, a game on the Kahoot app with multiple choice questions on college history chosen by me with occasional stories to supplement them and moderated by our alumni office staff. The alums who played had so much fun, we're considering doing it again.
That's pretty cool. Yeah.
Tracy, we need to talk. I have to do that with our alumni. Now I know what software what app I need to use.
Yeah, that's pretty cool.
Well, good. I think we are over time, actually, maybe. And
yeah, we are right on it. I want to thank you both. Yeah, we have a few minutes over, but we are fine. I want to thank you both for leading the session and this discussion, and thank you all for attending. We're now at our lunch hour, our lunch time, and so I think we have something else in the chat. from Bill, but I'll come back to it for just a second. We have our lunch hour now, and for our SCAA members, we'll be having our business meeting at 12:30. That the details for that were sent out by Jim, so you'll have access to entering that meeting with the code, with the message that was sent out yesterday evening. And so that will begin at 12:30 and go from 12:30 to 1:15. And so Bill has said SELA had a virtual trivia night where people were placed on teams and worked together with their teams, and then we all got back together. Gift cards were the prize. So thank you all for attending, and enjoy your lunch.
Thank you.
Thanks, everybody.
Bye.